Hello, my name is Wan Azrin bin Wan Asri. My metric number is H2280467. Today I'm going to present about the level of attitude, subjective norm, perceived behavior control, nutrition knowledge and healthy eating intention among university students. For background of the study, healthy eating is vital for physical and mental well-being, helping to prevent chronic disease such as obesity, diabetes and cardiovascular issues. In Malaysia, unhealthy eating habits among university students are increasing due to cultural preference, economic factors and convenient foods. Understanding this factor using TPP can guide intervention for university students aligning with Malaysia National Plan of Action for Nutrition to promote healthy eating among university students. For the problem statement, overweight and obesity are among the major health risks in Malaysia, whose prevalence rates have increased from 15.1% in 2011 to 19.9% in 2019 due to high intakes of processed foods and low intakes of nutrient-dense foods, characteristic of unhealthy dietary patterns among university students. Understanding these determinants are important to developing appropriate intervention targeting the psychological and social dimension of eating behavior. This study investigates which component of TPB predict university students' intention to eat healthily by analysing their attitudes, social supports and perceived behavior control toward healthy eating.
Assalamualaikum, my name is Nurhan Zuhaili. I would like to continue this presentation. Next, research objective. To determine the level of attitude, subjective norm, perceived behavior control, and nutritional knowledge toward healthy eating intention among FHPK students. Next, significance of study. The result validate the usefulness of TPP and offer crucial information about the variable affecting Malaysian university students' intentions to eat healthily. This result can be further applied to create intervention programs that effectively encourage students to adopt healthy eating habits. The result of this study will be theoretically and practically add to the body of information regarding the factors influencing the intention to eat healthily.
Assalamualaikum, my name is Nurida Binti Ghazali. I would like to continue the presentation. The literature review consists of three parts, which are understanding intention, barrier to healthy eating, and bridging the intention-behavior gap. Number 1, understanding intention, theory of planned behavior. Intention drive healthy eating shaped by attitude. Positive views string intention, while negative perception. For the subjective norm, social influences from peer, family, and trend. And lastly, for perceived behavior control, confident in managing challenges. Number 2, barrier to healthy eating. Knowledge gap, nutritional literacy aid decision but is not sufficient alone. Number 3, bridging the intention behavior gap. Despite strong intention, action may falter due to competing priorities. For the key strategies, goal setting and self-monitoring, supportive food environment, accessible stress management and education program.
For the conceptual framework, as you can see, there is 4 independent variables, which is attitudes to healthy eating, subjective norms, perceived behavior control, and nutritional knowledge. For the dependent variable, healthy eating intention among university students.
Next, I will present about research design. The study adopts a quantitative research design to examine the factors influencing healthy eating intention among university students. A cross-sectional study design was employed in this research, which involved collecting data at a single point in time from a specific population. A deductive approach is used to guide the research process and begins with theoretical framework. In this case, the theory of planned behavior and test hypotheses derived from existing literature and theory.
The population for this study comprised university students enrolled at the Faculty of Hospitality, Tourism and Wellness (FHPK) of 2,971 students for year 1 until year 4 from 3 departments, which are Hospitality, Tourism and Wellness department. Net sample size. According to Roscoe, for studies involving large population and elite sample size range between 30 and 500 participants. In line with this recommendation, therefore, this study target a sample size of 255 students from the Faculty of Hospitality, Tourism and Wellness (FHPK) at the University Malaysia Kelantan.
Next, is sampling methods. This study employed a stratified random sampling method to select respondents from the target population. Next, for data collection procedure, the data for the study was collected using a structured online questionnaire distributed to the selected sample of 255 students from the Faculty of Hospitality, Tourism and Wellness.
For the research instrument, the questionnaire was divided into three main sections. The first section will consist of demographics question including gender, ethnicity, age, marital status, education level, and personal income. The second section comprises of questions or items derived from previous studies to measure the attitudinal, normative, self-control, and intentional factors toward healthy eating. The number of questions for each construct are explained, which attitude has 7 items, subjective norm 6 items, PVC 3 items, and nutritional knowledge have 8 items. The third section comprises intention towards healthy eating, which have 13 items. All questionnaires consist of close-ended questions using a Likert scale format, ranging from 1 strongly disagree to 5 strongly agree. For the data analysis, descriptive analysis. In this research, demographic profile was analyzed by using frequency analysis and the data was presented in percentage. In this study, it was used to summarize and describe the demographic characteristics of the respondents and their response to the questionnaire items.
Next, the result of the frequency analysis showed the most respondents were male, while the rest were female. In terms of age, the majority were between 21 to 23 years old, followed by those aged 24 to 26 and 18 to 20. Most respondents were in Year 3, followed by Year 2, Year 4, and Year 1. By race, the majority were Malay, followed by Indian, Chinese, and others. As for their course of study, most respondents were from the SIP program, followed by SAS and SAH.
Next, result descriptive. Healthy eating recorded the highest mean score 4.19 among the independent variable. Attitude had the highest mean 3.99, followed by perceived behavior control 3.88, subjective norm 3.84, and nutritional knowledge 3.83.
For the discussion, the descriptive findings reveal that among the independent variables, attitude towards healthy eating scored the highest mean, M equal to 3.99, SD equal to 1.24, suggesting that students generally perceive healthy eating positively. This is consistent with previous studies indicating that positive attitudes are a strong predictor of healthy dietary intention. Perceived behavior control, M equal to 3.88, SD equal to 1.20, and subjective norms, M equal to 3.84, SD equal to 1.22, were also rated moderately high, indicating that students feel somewhat confident in their ability to eat healthily and are influenced by social environment. Nutritional knowledge had the lowest mean among the IVs, M equal to 3.83, SD equal to 1.15, implying that while students may have basic knowledge, there is room for improvement in awareness and understanding. The dependent variable, healthy eating intention, recorded the highest mean, M equal to 4.19, SD equal to 0.94, reflecting strong intention among students to adopt their healthier dietary practice. This supports finding that intention is a key component of the theory of plain behavior and a strong predictor of behavior when attitude, control, and norms are favorable.
Next, for the conclusion, the finding of this study indicate that university students demonstrate a strong intention to engage in healthy eating behaviors as reflected by the high mean score for healthy eating intentions. Among the predictor, attitude emerged as the most influential factor, followed closely by perceived behavior control and subjective norm, while nutritional knowledge score comparatively lower. This result align with the theory of plain behavior, emphasizing the importance of positive perceptions, social influence, and self-efficacy in shaping healthy eating intentions. Therefore, health promotion programs target these factors, particularly by strengthening positive attitude and improving nutritional knowledge, may effectively support healthier dietary practices among university students. That's all from us. Thank you.